I'm Dr. Wolf. I'm a forensic pathologist, and as such, I perform autopsies. And so, I'm going to start a series here. I'm going to talk a little bit more about some of the common things I see at autopsy. And today, we're going to talk about gallstones. This is not going to be completely, in-depth biochemical overview of gallstones, and nor is it going to talk really much about the surgery you would get for that. But rather, I want to show you what it looks like in place in the gallbladder, okay? So gallstones are something that I see very frequently in my job, because we have to take the liver out during an autopsy, and the gallbladder is actually attached to the underside of the liver. The liver is, of course, on the right side, just under the lower part of the rib cage. And the gallbladder is a small organ. It varies in size from the size of a golf ball to very large, the size of maybe even an avocado or something like that. And it's about the same color too. Usually it's a greenish color. And gallstones occur frequently in the West, in the Western world, in the Eastern world as well, but in the Western world, it's a higher incidence, and this is believed to be related to the diet that we have. And so many people have gallstones. In fact, most people have gallstones, and they don't even realize they have them. They're in place, they're in there, they're not causing any problems. And then at some point, they will cause problems because the gallstone will obstruct the flow of bile. Okay, so you have to understand that you have the gallbladder, and then there's a duct, the common bile duct, that comes down to where the small bowel and the pancreas is. And that's where bile comes out when you are digesting food. Well, sometimes those little stones can get lodged in the common bile duct, and then it'll cause the bile to back up into the gallbladder, and it can cause inflammation and infection, severe pain, and very uncomfortable for those who have had it. Now, I'm going to show you an image that I had of a gallbladder with gallstones in it. Now, this one's interesting because typically the gallbladder wall is opaque, meaning we can't see through it. But this one, it was actually translucent, which means it's not completely clear, like transparent. Translucent means some light can pass through. But you could actually see the gallstones through the gallbladder wall. And so I'm going to show you what that looks like. And then I'm also going to show you when I open it, what it looks like when the gallstones and the bile come out. Okay. So if you're squeamish about seeing organs, internal organs, things like that, you may want to scroll past this video, but most people come to my channel because they want to see these things. So now I'm going to show you what that looks like. All right, so this is the gallbladder. You can see me pushing on it there. And inside, those yellow-orange little spherical structures, those are the gallstones. So you can see this is a translucent gallbladder. Now, with a 22-blade scalpel and some forceps, I am opening the gallbladder to release the bile. As you can see, it's very thick, like sludge, and all of the gallstones pouring out there about the size of a pea. So these are cholesterol gallstones. So again, this is a standard procedure at autopsy to take the liver out, to open up the gallbladder and characterize its contents. This one did not have any inflammation. This one was just unusual because it's translucent. The gallstones themselves are very typical gallstones that you see, although they can have many forms and many sizes. But no inflammation to speak of here, just kind of an interesting finding, and I don't get the sense that this actually bothered the patient. Although you can see when I cut that and the bile pours out, it's very thick. We use the term viscous. And so when we get very viscous, this is called gallbladder sludge, and this can cause a problem with the function of the gallbladder, and people can have right upper quadrant pain and things like that after they eat. So I just thought you'd like to see this. I'm going to try to show more anatomy and basic pathology type stuff on here so that you can learn what it looks like in reality and outside of a textbook. So thanks for watching.